Sunday Morning Matters on KC24, your local election headquarters.
We have sick care for everybody. We believe in health care, and we have made another incremental step.
You're watching Sunday Morning Matters on KC24, your local election headquarters.
We have sick care for everybody. We believe in health care, and we have made another incremental step towards that vision.
California officially the first state to offer taxpayer-funded health benefits to young adults living in the country illegally. Governor Gavin Newsom signed the bill earlier this week. Our Capitol Bureau reporter Ashley Zavala with more on who benefits and what this means for you, the taxpayer.
On the same day California defends the Affordable Care Act in federal court, Governor Gavin Newsom and some state lawmakers spent time at a community health center in Sacramento. 90% of the patients served here are on Medicaid or Medi-Cal, a program that could see changes if the Affordable Care Act is found unconstitutional, possibly leaving millions of people without health insurance.
Over half of the country under the age of 65 is holding their breath, waiting for a decision of the Fifth Circuit. That's the 133 million Americans with pre-existing conditions. That's how consequential today is.
The governor celebrated the contrast between the White House and California. The state's new health plan is similar to the ACA, requiring Californians to pay a tax if they don't purchase health insurance. The state is aiming for universal health care and is soon expanding coverage to anyone under the age of 26, regardless of immigration status.
We are the most un-Trump state in America when it comes to health policy, and I'm proud of that.
Anticipating more demand, the state is sweetening the deal with loan repayment programs for doctors who promise to serve poorer patients, like Dr. Byron Ruiz, who just found out $300,000 of his debt is gone.
And I enjoy working with these patients, and it is kind of hard keeping up with those loan payments.
But if the Affordable Care Act is found unconstitutional, that'll present a new challenge to California's so-called Health Care for All plan.
But to the extent that we get impacted with millions of people that lose Medi-Cal coverage, I'm not here to say overnight that we'll be able to subsidize those losses. That would be misleading. But we would begin to rebuild that framework.
Ashley Zavala joining us now near the state capitol there. Ashley, the governor says this new health care plan will benefit 90,000 illegal immigrants, costing $98 million to the taxpayer. But the question is the governor still looking to the Trump administration to help out?
Well, automatically, yes, because that $98 million appropriated, a quarter of that is actually from federal funds, and that money is actually protected in federal law. So, yeah, I mean, California is going to use this federal money hand in hand to expand this program.
Ashley, you have to wonder, the Trump administration, he's not going for this. It sounds like this is going to go to the courts at some point.
It really might, and it really might raise the question of how much does that federal law apply to undocumented citizens. But the governor, when we asked him, you know, what does he think about the Trump administration saying that they would stop this, he said, oh, you know, what's he going to do? Because the law protects them, but we'll see how much protection California gets from this.
And Ashley, any word on when this will actually take effect, and when could this actually go into the hands of the taxpayer, and not only that, helping illegal immigrants up to the age of 26?
So right now, no, even though the governor just signed this bill into law, it doesn't take effect until the 1st of January on 2020. That $98 million appropriated for this program is only good for the first 6 months of the program. So essentially, this time next summer, lawmakers will have to figure out how to appropriate that funding. The governor's office estimated in one of the latest hearings on the budget that this would actually cost $250 million every year to implement this cost. But again, they have to figure that out and how they'll appropriate that money.
Ashley Zavala there in the state capitol. Ashley, still very much in the early stages. Thank you so much for being with us here on Sunday Morning Matters.